Go.
Hello everyone, how's it going? It's Dr. Rajeev Fernando with Infectious Diseases here again for another update with coronavirus 19. And doctors, nurses always get spoken about on being the front lines of this, but there are a group of people who I think are very important in managing these critical patients, and that's the respiratory therapists. And I'm here to talk to Sasha and Sarah today. Thank you so much for being here.
Thanks so much, Dr. Fernando.
Yeah,
Thank you.
I really dig the new,
You did?
yeah.
Thank you so much.
I actually thought you were Ron Jeremy. I was like, what was
Well,
that?
that is a huge compliment. Thank you so much. Ron Jeremy is legendary. Thank you so much for having that. So I want to start off, before getting to the professionals, let's start about the basic oxygen requirements, what you and I need. So for starters, you and I are breathing at 21% of oxygen. That's what we're doing right here, right now. Now, when someone gets sick with COVID-19, they come into the hospital and they require extra oxygen. So the way we start off is something called a nasal cannula over here. And this nasal cannula, you can use up to 40% of oxygen. After that, you use something called a ventimask. And after the ventimask, Sarah, what is this we're using over here?
So this is a non-rebreather, and it can provide up to 100% or approximately 100% of oxygen.
So this is how we're using this over here. This is going to be full of air, and this is what's called a non-rebreather. So you guys take it from here. So what happens when a patient is actually failing a non-rebreather? What would you guys do in this situation?
So as a respiratory therapist, our biggest responsibility and our main responsibility is ventilation, meaning that when a patient cannot breathe, we have to put an endotracheal tube that looks just like that, we're not going to open it obviously, into a patient's airway. And then we connect this to a machine just like this, or this particular machine, a ventilator. So, and the ventilator would actually do all of the breathing for the patient. As respiratory therapists, we actually manage these ventilators. Now, that might sound very easy and simple, but it's actually very, very difficult because every patient is completely different and require different settings, different ventilation, such as respiratory rate, tidal volume, oxygenation.
And so it means at times you're by the bedside up to an hour at times, right? Making these changes all the time. You know, the doctors, we write our stuff, we write our recommendations, but you guys are adjusting the ventilator according to the blood gases. That's correct.
Absolutely.
Right. Yeah, usually after like an intubation, we can spend up to like an hour, if not even more, especially with like a COVID patient.
Absolutely.
Just, in and out of the room, just correcting these settings just so that they'll best fit the patient.
Of course. So what are your thoughts now? We're getting new information about the situation about ventilators where we're running out of them. What are your thoughts about using a ventilator for 2 patients? I know it's not guideline driven, and it's a hot topic out there with controversy, but you guys as experts, what do you guys think?
Definitely. We've seen it before, and Sarah actually did some research with our director a couple of days ago. If you want to
it's definitely not ideal, and we don't recommend it at all, but we acknowledge the fact that it has been done and it can be done. Down the line where there's no more ventilators, what can we do?
It's a problem. It's really hard, even for us on the front lines. We see patients, and there is going to be this time when we're not going to have enough ventilators, and we may have to choose, unfortunately, who goes on and who doesn't. Of course, that should be done in conjunction with an ethics committee. We have to work with them together, all of us be on the same page, multiple teams before you make that kind of a decision. But also what they look at is usually we have a less than 1 year life expectancy. That's one of the criteria. So lots of challenges still coming for us. And I'd like to thank our respiratory therapists,
Thank you so
Sasha
much.
and Sarah.
Thank
We'll
you.
be back with you sometime next week. You can give us an update on what everything's going on.
Yeah.
Thank you so much for joining us. We'll see you on the flip side. Thank you.